I'm talking with Dr. Richard Rosenfield, who's the medical director of Pearl Women's Center, about one of the most common surgeries women face, and that's hysterectomy. Dr. Rosenfield, you're a leading expert in a minimally invasive alternative to the traditional hysterectomy. That's a mouthful. Can you explain the difference?
Well, laparoscopic hysterectomy refers to basically taking all the exciting advances in technology and now transitioning them to medicine and allowing women to have a very pleasant experience for a surgical procedure which they've been facing for years and years and years. But with the laparoscopic approach, instead of making a large incision across the abdominal wall, we can now take very small incisions and transition this surgery that's been a very difficult thing for women to face and move it into a totally outpatient environment, allowing women to have a fast procedure that's virtually painless with an extremely fast recovery, allowing our patients to get back to work and get back to their families without much trauma.
What exactly is removed during a hysterectomy?
Well, the word hysterectomy actually refers to removal of the uterus, which is nothing more than a muscle, and this muscle is something that's used to house a baby during pregnancy and, of course, childbirth. The lay people's terms referring to hysterectomy, words like total or partial hysterectomy, oftentimes refer to removal of the ovaries or the fallopian tubes as well. And depending on the medical problem that a patient might be facing, there are a variety of different types of hysterectomies that are performed. Our goal is to provide any of these services in a really minimally invasive approach, so with really small incisions and a short recovery with not a lot of pain.
I think one of the big fears is when you think hysterectomy that it's going to somehow change your hormones and your sex life. Can you talk a little bit about that?
Sure. Well, many women are faced with problems that already are affecting their sex lives, and that they're either having a debilitating period that's lasting for over half the month, or they're having pelvic pain, or perhaps they've got large fibroid tumors or something like that on their uterus. When we do the hysterectomy, we actually see in many of our patients a dramatic improvement in their sex life because they don't have these concerns about unpredictable bleeding or pelvic pain, that sort of thing. But as far as hormones go, if we just simply remove the uterus, there is no impact on hormone function or sex drive.
Do a recap for us, Dr. Rick.
Yeah, the hysterectomy that most of us are aware of is the one that our moms had, where they were in the hospital for 3 days and off work for 6 weeks. Modern medicine has completely catapulted us to a new realm of surgery here, where we can take a series of very small incisions, and with the same surgery, we can have a patient in and out of an outpatient facility in a matter of hours, and back to work, back to their families, back to the gym in a matter of days instead of weeks.